and today I'm multitasking. I'm recording on a podcast through voice recording, and then I'm also recording via video as well. So let's see how this goes. Hello, my beautiful souls and fellow warriors. Welcome to Diary of a Fiber Warrior podcast, and I'm Chico. Today's episode is about the unusual symptoms of fibromyalgia. If you're tuning in, you're likely familiar with the common symptoms like chronic fatigue, chronic pain, cognitive fog, but the other lesser common symptoms that deserve our attention too. Living with fibromyalgia can feel like navigating through an endless maze of symptoms that defy easy explanation. So let's dive into some of these unusual symptoms that might catch you off guard. Okay, starting off with costochondritis pain. So imagine a sharp dagger lodged in your chest. It's an inflammation of the cartilage connecting your ribs to your breastbone. The pain can feel sharp, dull, aching, or pressure-like, and it can worsen with movement such as coughing, deep breathing, sneezing, or stretching, and it can be quite alarming, often mimicking heart-related conditions. You might think that you're suffering from a heart-related condition if you're unfamiliar or if you're newly diagnosed with fibromyalgia or have never experienced this type of symptom before. And this is something that has happened to me as well on numerous occasions, especially in the beginning. It usually caught me off guard. Tips of management. Breathe slowly and relax as much as possible. Remind yourself it's not your heart, although it may feel like that. But then again, if this is something that's very unusual and it's nerve-wracking and you feel uncertain, especially if you've never experienced this type of symptoms before, it's usually worth checking if you can't connect to the triggers, such as like extraneous exercise. You might have been stretching or lifting something unusually, and if you don't recognize any of those symptoms, it's better to seek medical advice immediately. And as I mentioned before, I was often caught off guard, and it does feel very it's uncomfortable. So the discomfort can go on for days or for weeks, just depending on what the potential trigger is. Okay, so then moving on to stiffness, and this type of stiffness is something that is usually all over the body, and it's not the cool kind of stiffness, if there's ever such a thing. But picture this: you wake up in the morning and your body feels like it's turned into an ancient oak tree overnight, and this is what I could just imagine. So you wake up, you're ready to get ready for like your day, you jump out of bed, but then morning stiffness, especially somebody with experiencing like chronic type symptoms like severe chronic pain or joint stiffness, can be an unwelcome alarm clock. You will feel like every joint is creaking, and also your muscles resist any type of movement. So then let's move on to tips for management. What I've often found very helpful is taking your time before you jump up quickly out of bed, if that's even possible. But then just to lie down first and start stretching your body slowly whilst you're lying down. And this is to awaken your body and your muscles slowly before your feet touch the ground. Then when you're able to, as you feel alert enough, and whilst you're sitting, you can also do some gentle stretching, and then follow that with a little bit of like walking, just to get a sense of how your body is. If they're not, so if you're feeling some level of like comfort, that can be followed up with taking like a warm shower or dipping into the bath for longer, so that to help your muscles relax. As again, take your time to stretch, and if you have like any appointments planned, it's often helpful to wake up like a few hours earlier, so that you give your body time to come to itself. so that you feel a little bit more relaxed and your body feels less stiff. And you may also feel that your feet are swollen as well. This has happened to me like on numerous occasions. The stiffness is just like a regular thing that most of us just become accustomed to. Then moving on into hyperhidrosis. Imagine you are in an air-conditioned room, minding your business, when suddenly you start to sweat profusely. Okay, so it can be socially distressing and also impact self-confidence, because then your body is not regulating itself as it normally should. You're in a cool environment, but you're still profusely sweating more than you've prepared for. So usually the best thing to do to minimize some of the symptoms where possible is to dress in layers, to come prepared, use antiperspirants, and also try using daily tropical creams that help dry your skin. And then one of the other tips that is mentioned here is manage stress levels through relaxation techniques. This can also help reduce sweating, which is something that I didn't know. And it's a condition that I'm familiar with it. What I experience is more about my body being unable to regulate temperature, whether it's hot or cold. And sometimes I'm like packed like with layers of like blankets just to help to regulate my body. Then moving on into sensory overload, so neurosensory symptoms, which can feel unusual. You may not connect to it immediately when you're diagnosed with fibromyalgia and chronic fatigue syndrome. Imagine you're at a party or a social gathering where there's lights flashing and there's music blaring, it's too loud, and everybody is chatting at the same time. And you may start to feel overwhelmed. You may start to also, your brain signaling that you need to exit, you need to leave as soon as possible. At the same time, you may not even understand like what's happening, and you may start to also experience like some form of like anxiety of get me out of here, as soon as possible. What do you do like in those instances? So it can also feel like sensory fireworks inside your skull. Your brain may start to, or the back of your head may start to hurt as well. Limited concentration can also be an impact. You find it difficult to concentrate on what people are saying, and just find the whole environment overwhelming. So what are the useful tips? I usually plan, I always have like an exit plan. I go to social events where I know I can easily get out of something, first of all. I don't force myself into any situation, especially if I feel like I'm starting to feel some form of symptoms. I either go out and take a breather, or I quietly exit and leave without feeling apologetic or making like any excuses. And people who know me have got accustomed to this. I've got accustomed to my habits. So some of the tips of like management suggestions are wearing sunglasses indoors if that helps you, wearing noise cancelling headphones, which can help as well alleviate some of like the sensory overload, or choosing environments where it will be less noisy, the music will be like much lower, just planning ahead and thinking of all the things that could be potential triggers. And some of it could be unavoidable, but it's preparing as much as you can, and also having an exit plan where you're not feeling guilty or pressure to stay in certain environments, especially if you're becoming overwhelmed due to the symptoms, which can't be helped, because some of the symptoms do occur as a result of things that are beyond your control. So create a sensory friendly environment wherever possible to help you minimize those symptoms. Tissue overgrowth is the next one. Lipomas. Lipomas are benign fatty lump under the skin that some fiber warriors develop. They can be painful and affect body image. So the tip here is, if you feel something unusual growing, in a place where it's unexpected, consult a health professional. if you notice unusual lumps, to get the right guidance and treatments, just to ensure that, you know, whether it's lymphomas or not, then at least you know the appropriate action to take instead of panicking on your own. And then moving on to type of unusual symptoms, it's allodynia and then hyperalgesia.